International Journal of Health Policy and Management. Quality and speed are our culture and the keys to our success. Welcome to the audio summary section of the International Journal of Health Policy and Management.
Okay, hello, my name is MacLachlan from Trinity College here in Dublin.
Hello there, I'm Hasheem Mannan from University College Dublin.
Hi, my name is Tessy. I am also based in the Centre for Global Health in Trinity College Dublin.
And we're also presenting on behalf of two colleagues who co-authored a paper with us in the International Journal of Health Policy and Management. And they are Alister Munthali from the Centre for Rehabilitation Studies at the University of Malawi and Mutamad Amin from Afad University for Women in Khartoum in Sudan. And this paper that we did was a response to another paper by Ivanova et al. And they looked at sexual and reproductive policies across 4 different European countries using EquiFrame, which is an instrument that we've developed here in the centre, but also with these colleagues we've mentioned and with other colleagues who were part of the Equitable Consortium. So EquiFrame is an instrument to look at the inclusion of vulnerable groups in health policies and to what extent they're afforded the highest possible standards of human rights. We developed it over a couple of years, doing consultations with countries in Africa, drawing on key principles of international human rights declarations, and also looking at best practice in terms of evidence reviews of the literature. And we've ended up with 21 core concepts of human rights and 12 different vulnerable groups. And these may be used, all of them, or in part by people using this EquiFrame to analyse policies.
And what Ivanova and her colleagues have done is quite that. They've explored the flexibility that is available within the framework, and they've chosen a range of the vulnerable groups and a select number of core concepts and applied to the policies, sexual and reproductive health policies from 4 of the European countries. And they've, on basis of that analysis, indicate that the Spanish policy has incorporated fundamental principles of human rights and vulnerable populations to a greater extent in comparison to the other countries in the analysis, and Ukraine had been ranked 4th out of the 4 countries for the comparative analysis. They've also highlighted in that process the applicability and involvement of policymakers in a discussion to understand the process of policymaking, which isn't captured in EquiFrame. However, further work from the research group does provide a pathway to exclusively look at the process of policymaking and how inclusive it is, and that is the body of work on EquIPP.
EquIPP, which stands for Equity and Inclusion in Policy Processes, looks specifically at the formulation of the policy and then the implementation, as well as the monitoring and evaluation and the dissemination of the policy. While we felt that it was important to have an inclusive content, we also really felt the need to emphasise the process around that, and particularly in relation to vulnerable groups and the extent to which they participate in this process. EquIPP was developed in conjunction with numerous UN agencies. It was developed over a year. It's mostly based on a literature review, looking at existing approaches and existing evidence, what are other actors saying and doing in this area. And then it was also put to stakeholder consultation, of which we did multiple reiterations. And this was then synthesized into 17 key actions for an inclusive policy process.
Okay, great. So in summary, we'd like to congratulate Ivanova et al. On their paper, and particularly the idea that they sort of innovatively used some of the core concepts in EquiFrame and they've added additional vulnerable groups. We'd like to encourage other people to use EquiFrame in that way as well. EquiFrame is available on the web, freely downloadable. There's a manual available, and there's lots of internationally peer-reviewed papers. And within the next couple of weeks, we hope also to be making EquIPP freely available to download on the web, so that you have the analysis of how a policy is made, you have what's in the policy, and then you have the analysis of how the policy is implemented in terms of social inclusion and equity. So I think from the three of us, thank you very much.
Very much.